Hey guys, it's Dr. Abraham, Valencia Medical Center with Bianca over here. We're doing our live at 5 today, and we're talking about any questions you have, but I think we're going to focus a little bit more about IV therapy and vitamin shots, vitamin injections today. So we put some of the questions that you guys had sent us over the last week or over the last couple weeks over about IV together. And we'll be taking any questions during the live as well. So thank you guys for joining us.
The immunity.
Yeah, so IV therapy refers to basically connecting you to a bag that's infused with vitamins, and specifically what vitamins we're going to be placing in that bag is going to depend on which IV we're doing and what treatment we're trying to do. But a lot of people are familiar with the IV bag that is connected when you're in the hospital, and we give IV bags in the hospital for so many different reasons, for hydrations, for many other things. So it's a similar process, except we're not just giving you normal saline in that bag. We're giving a bunch of vitamins and nutrients and electrolytes directly into your bloodstream, directly into your vein. And the idea behind it is many of us unfortunately don't get enough of the vitamins that we need through just food alone, through our diet alone, for many reasons. The quality of the food we eat is definitely one of them. And taking vitamins as supplements is great, but a lot of the stuff that we take orally is gonna be broken down in the stomach, and so it doesn't get fully absorbed. So when you're doing it in the IV, you're getting 100% absorption because you're putting it right there in the bloodstream.
So we shouldn't be eating the cookies that we brought in
We
today.
shouldn't be eating the cookies that Bianca brought in. Even though she says she's on a keto diet, she brought...
Okay, we digress. So can you explain more about do we offer additional shots with the IV therapy?
Yeah.
And can you explain a little bit as well, like the B12 and the MIC?
Sure. So yeah, the B12 and the MIC are the two big ones. Sometimes you also do B complex. So you can do these in addition to the IV. Sometimes people come in and do the shots on their own. Many people do the IV like once a month, and they will add the shots at that time, but then they might even come in between just to do the shots. One of the benefits to the shots is that it's much quicker, much easier. You come in, we give you the shot, and then you're out. Whereas the IV might take, anywhere between 30 minutes to 45 minutes to get all the vitamins in. The advantage to the IV is that you can get more vitamins. You're obviously going to get a lot more hydration through the IV because you're getting the full bag. But if you wanted something in between that's much quicker and still going to give you some vitamins, the B12, the B complex, the MIC are a very common one. The MIC specifically is often used for people who are trying to lose weight or just need a boost in their metabolism. And so sometimes it's called the skinny shot, the skinny booster, the lipotropic shot. I've heard it being called the fat burner shot. So there's so many different names for it, but it's a shot to help boost a person's metabolism. B12 plays so many different roles in the body, whether it's with nervous system or absorption or energy or sleep. A lot of people do associate B12 shots with energy, and they get it if they're feeling low on energy and they just want a little bit of a boost of sustainable, kind of prolonged energy. The B12 is great for that. So yeah.
Okay, and is there any side effects of IV therapy, and is it safe for the general public, for anybody to come get it?
For sure. I mean, we definitely do a medical history for each person before they come in to make sure that it is, there isn't any contraindications or anything like that. But generally speaking, it is a very safe procedure. I mean, these are vitamins that we've already been exposed to, through our food supply and, vitamin pills and other stuff. We're just given a higher doses, so they're not going to be, new medications. So yeah.
How long does it usually take to receive IV therapy?
Anywhere between 30 minutes to an hour, depending on what we're doing. Yeah.
Okay.
So not too long.
How often can our patients come in to receive IV therapy?
Depending on which one we're doing. I know I've mentioned sometimes we have like the immunity booster, the energy IV, we have the virus cocktails, and these are just different names So to make it easier for the clients and for us to kind of like choose a different IV. But a lot of people like to do it once a month. If you're having a bad month or even a bad week, you can definitely do it more often. Some people are like recovering from a cold and they might come in like even more than once in the same week, like 2 or 3 times in the same week to really kind of give themselves that boost that they're looking for, and that's definitely still safe. But for the most part, people are doing it like once a month is good kind of rule of thumb for most of these IVs.
All right, great. A couple other questions. There's one person that asked that they're scared of needles, so they're curious if it will hurt, and then if bruising is a side effect of.
There's a chance of bruising whenever we put a needle to the face. Usually, not from the IV per se, not from the vitamins per se, but from starting an IV, we're gonna have to poke the vein. Honestly, most of our clients they don't get any bruising or any significant bruising, but it definitely can happen. But it'll go away. I mean, the IV itself doesn't really hurt. It's again just the initial poke. So we poke you initially to get the IV started. You'll feel a little needle poke. It's really not a big deal, but it's not like you're gonna be feeling the needle the whole time the IV is running. It's just the initial poke, and then we establish the IV and we take the needle out, and then we connect it.
All right. Who actually would be administering the IV? That was a good question.
So yeah, usually I'm the one who starts. We also have well, for the most part, if the day that where I'm here, I'll be usually starting the IV. Usually the client is gonna come in. We'll talk. We'll kind of decide on what IV we're doing, what vitamins we're doing there. Once we make that decision, we start the IV, and I mix the IV bag. Depending on what we decided on, which IV bag we've decided to do, and then we connect it. So all the IVs are gonna be, we mix them in house, based on what the client needs. They're not like pre-mixed or pre-packaged or anything.
Is there any preparations that someone needs to do before they come in for IV?
No, just drink a lot of water. Stay hydrated. It makes it easier to find the vein. Avoiding Advil is sometimes helpful to prevent the risk of bruising, but it's not a big deal. We do it on people who are taking Advil or ibuprofen all the time. Just the main thing is, drink water if you can. Try to stay hydrated to make it easier to find the vein.
I know that we talked about like vitamin B12 and MICs, but is there any other add-ons that we can do?
It's a great antioxidant. It's like a super antioxidant. Glutathione is great for detoxification. It's also for a lot of people actually get it just to help with the skin.
Okay.
And as an antioxidant, it really does that. But also even within the IV therapy itself, like that's where the customization of the IV is helpful. So we might be adding amino acids for people who are like more athletic or are doing it for, for more like fitness related reasons. We might be adding more vitamin C for people who are kind of looking more for the immunity aspects of it. There's magnesium, calcium. It'll depend on each person.
How soon will a patient start noticing some of the benefits and the beneficial changes?
Right away. In terms of the hydration, that's something that people are going to notice, as soon as they're walking out of the door. A lot of the other stuff, usually within a couple hours, like in terms of energy, it's going to vary, but many clients within a couple hours, they're already like starting to feel a difference. I would say from the moment they walk out, like as soon as the IV is finished, usually by the time we're disconnecting people, they're like, I'm already feeling better. But then within a couple, 2-3 hours, it kind of kicks in a little bit more too.
Awesome. All right. And then I think you just talked about this, how would, somebody asked, how would I feel after? So is it, like you said, that you'll start feeling changes pretty much right away, right?
Yeah, especially in terms of the hydration, the activity, you might end up going to the restroom a couple times afterwards, so
you're getting 500 cc's of fluid in you.
You're getting all these fluids, and it kind of helps with as it goes through the kidneys, it helps, it filters through the kidneys, so that's possible.
All right. Actually, somebody had just asked as well, how effective is IV therapy for your immunity?
I mean, it's very helpful for your immunity. It's again, it depends on what we're doing it for. It's not gonna take the place of an antibiotic, for example. So if someone needs to be on an antibiotic because they have a tooth infection or something, it's not. We're not gonna be like, well, just come in and get an IV and you're fine. But where it's very helpful for immunity, or we see a lot of people come in, is again, if it's like a viral infection, so like a common cold. Somebody's recovering. A lot of times, even after we fight a cold, there's that kind of like lagging period where we're not like really feeling 100%, and we're just kind of dragging through the day. It can be a great boost during that time. We have a lot of people who come in like let's say before a flight, or before they know they're going to be exposed to some kind of stressor in their lives, and they want that boost before they do it. But I mean, we've seen a lot of like great, we find it to really be helpful in people who are, trying to like fight an infection or something. Again, not in place of an antibiotic necessarily if someone's really like needing it, but kind of more of a supplement. It's just like if you are sick, you want to be like eating healthy, you want to be getting your vitamin C from all the food and stuff, and if you can get really high doses of vitamin C through the IV, then why not? It can be very beneficial that way.
So like with the holidays coming and the stress of the holidays and the cold and flu season coming on, it's helpful, right, to get...
For sure, and we always do see like kind of an increase in the number of clients around these times. Because the holidays, a lot of people are out, they're with their family, they're having fun, they're partying, maybe they're drinking, and they kind of get in that mode, because there's a lot of people traveling and stuff, and at the same time, like you said, it happens to be the beginning of the fall. A lot of people, their allergies kind of act up. These kind of like cold viruses start to show up, so we do expect that we're probably going to be seeing even more IVs in the next like month or two.
All right.
I think
that's it. That looks like
good
that's
for now. Perfect. Well, thank you guys for joining us. As always, send us any questions you have, and we'll be back here next week. Thank you.
Bye, everyone.